Okay, here we have the bean-shaped kidney. The hilum, top item on the list, is this dented region on one side of the kidney. There's the hilum, or sometimes called the hilus. Now we'll turn this around and we will find, actually we'll start on this model. Some of the things are easier to see here. The renal capsule is the connective tissue layer that binds the kidney together. It's on the outside. Then we have a cortical region. Here is the cortical region. This is the cortex of the kidney from here to here. Then we have the medullary region. The medullary region is this region right here. The medullary region contains the renal pyramids. Here is a longitudinal cut through a renal pyramid. Here is the actual pyramid represented. The pyramid comes down to a renal papilla, and that's what this little nipple-like structure is right here. The renal papilla drains urine into a calyx. Here's the little space. This is the calyx. Two minor calyces join together to form a major calyces. It joins together to form the pelvis. It's the path of the urine. A couple of things on your list. We have the cortex, the medulla, and in between these two renal pyramids is a renal column. That is cortical tissue that dips down into the medulla and is found between the renal pyramids. We have the pelvis draining the urine into the ureter. And in between the pelvis and the ureter is sort of a funnel-like structure called the uretopelvic juncture. Now I want to do the blood vessels, but I want to start those on this model. They show nicely on this model. On this model we have the renal artery and the renal vein outside of the kidney. Once the blood supply has entered the kidney, it divides into smaller vessels. These vessels carry the blood across the pelvis, and they are called segmental arteries. So segmental arteries across the pelvis. The blood supply then travels between the two pyramids in the renal column, and in the renal column, the blood supply is called the interlobar artery. In between the pyramids, in the columns, interlobar artery. The blood supply then arcs around between the medulla and the cortex, and that arcing blood supply is called the arcuate artery. From the arcuate arteries, here's another arcuate artery, here's another arcuate artery. The blood from the arcuate arteries moves up into the cortex, here's the cortex, by way of interlobular arteries. So this is an interlobular artery, as is this, as is all the little red lines represented in the cortex. Those are all interlobular. So here's arcuate, here's interlobular. The interlobular gives rise to tiny, tiny arterioles that lead to the nephron. Those tiny, tiny little arteries or arterioles are the afferent arteriole right there. And that's as far as we can see on this model. Now the blood supply draining the kidney is basically a mirror of what we've talked about, but we'll say veins. These little blue lines here are the interlobular veins. The blue lines arcing between the medulla and the cortex are the arcuate veins. So here the arcuate veins are. The blood supply draining those arcuate veins found in the renal columns in between the pyramids is the interlobar veins. That leads to the segmental veins carrying the blood across the pelvis, and the vessel that drains the kidney as a whole is the renal vein. On this particular model, let me point out a few things. Here are the pyramids, representations of the pyramids. Here are pyramids cut longitudinally. This would be the apex or the papilla of the renal pyramid. And this gray right here is representing space. That is a minor calyx, where they join together, they would form a major calyx. And on this one, this is probably the best one to see. Here's a minor calyx, here's a minor calyx, this is a major calyx. When they come all together here, we have the pyramid. I'm sorry, not the pyramid. We have the pelvis. Here is the ureteropelvic juncture, and here is the ureter.